All right. I think we're going to go ahead and get started. Welcome, everyone, to discussion about effective legislative advocacy, how we can all work together to better advance better mental health policy and budgets. Our focus today is really going to be at the state of Oregon level, but a lot of what we're going to talk about is applicable to your city, to your county, to federal advocacy, although we can talk some in the Q&A about federal advocacy because that's right now it's kind of its own animal. This is largely going to focus at the state where you actually can pass things, where they actually have a functional legislature. So some limited applicability at the federal level. My name is Dave Hunt. I'm the executive director at NAMI Clackamas. Allie Linfoot is our board president. So we're going to be co-presenting today. We're glad you're all here. I'd say the headline for this whole discussion is legislative advocacy in Oregon anyway. Don't be scared. It's very accessible. Elected officials and state agencies staff and legislative staff actually want to hear the expertise that you bring, and you can actually make a difference. So we're going to start with okay, there we go. Great, thank you. So a few nuts and bolts. How many of you would say, well, how many of you have lobbied your state legislator? Raise your hand. Okay, so that's great. So about half of you. So a few nuts and bolts about the legislative process in Oregon, because it is unique from some other states, and actually it's changed a lot in the last 15 years. Oregon, because we have a biennial budget, a 2-year budget, we have long sessions or regular sessions in the odd numbered years like this one, where the legislature is basically in for 5 months. And then as part of that, they're passing a lot of policy bills, but they are also passing a 2-year budget. Then they come in even numbered years, and they're only in for 5 weeks. So 5 months in the long session, only 5 weeks in the short year, even year session. So in a year like this one, they convene in mid-January. In this year, they have to be done by June 29th. And they usually go pretty close to the deadline. That's actually a big change in Oregon. I used to serve in the legislature, and my first session when I was a freshman, we were in until the end of August. So that's the longest session in Oregon history. It will never happen again because we changed the Constitution. And this is the model we're in now. If how many of you remember seeing on Saturday morning? I don't know. Is this dating us? I'm just a bill, only a bill. Is that still on Saturday mornings? Okay, so we are old. You're saying. Thank you. Appreciate that. Schoolhouse Rock, very, very accurate. I think it even though it's talking about Congress, very accurate. The whole process of because every state except Nebraska has a House and a Senate. Some of us who served in the House would say the Senate's duplicative, but the senators feel the same way about the House. But every time you have a budget matter or a policy matter, it has to get a majority of House members, and then a majority of senators, and then a governor's signature. You'll hear in Salem the catchphrase 31 and 16 and 1. 31 House members, 16 senators, and 1 governor's signature. And so that process plays out for every single policy bill. Frankly, it's a process that is better designed to kill bad ideas, because to navigate through a House committee and then a House floor and then a Senate committee and the Senate floor, if it has budget implications, it goes down to the Joint Ways and Means Committee, or if it has tax implication, it goes to the Revenue Committee, and then still has to go to the governor's office. All that in 5 months is very difficult. So the people who wrote the Oregon Constitution were not trying to make it easy, which in some cases is good because there's a lot of stupid ideas that are proposed in Salem. But even the good ideas have to go through a challenging process. Almost everything just requires a simple majority. Every policy bill, every budget requires a simple majority. I think the only 2 exceptions in Oregon that require supermajorities are anything that raises revenue. So like 2 years ago, we had a bill that was NAMI's number one priority to fully fund the 988 mental health crisis lines. But it did it with a 40-cent tax on cell phones. That raises revenue, so it required a supermajority. So we had not just to get a simple majority, but a 3/5 supermajority in the legislature. Yes, sir. It's 3/5 when it comes to revenue. So, like in the House, instead of getting 31 votes, you have to get 36 votes. Or in the Senate, instead of getting 16, you have to get 18. There's also a weird thing. There are a couple places that do require 2/3 supermajorities. Um, but those are mostly changing criminal justice laws. I'm not a fan of the supermajority process, so I'm not here to defend it because I think things should be decided by a majority. But almost everything, like the issues we'll talk about later, are all majority votes. If you'd advance to the next slide, because my clicker's offline. Yeah. They actually, no, it just requires a simple majority to end discussion. Yep. If someone calls the question, it just requires a simple majority to end discussion. Could you advance to the next slide? Great. So it's important to know your audience in Salem. Sometimes you might be talking just to your legislators. If you don't know who your state representative and your state senator is, I'd encourage you to look that up this week. So you walk away from here knowing who is my state senator, who is my state representative. We all have one of each. Sometimes you might be down advocating with others. So it's important to know your state rep and your state senator and what their background is, who they are. Have they been there a long time? Are they new? Do they have a particular passion or expertise or lack of expertise? What are you walking into? But also, if you're meeting with someone, like we tend to meet with the 17 legislators from Clackamas County. So we will often put their constituents up front, but then there'll be others of us. Like Allie, even though she happens to be represented by Senator Meek and Representative Hartman, she's been in meetings with a whole bunch of other legislators from Clackamas County. That's okay. It's just the more you know, the better off you're going to be. Right now, we do have a supermajority of Democrats in both the House and Senate. Right now, it's exactly that 3/5 supermajority we were talking about earlier. Although actually, there is one vacancy. A senator from Wilsonville just died last week, but he'll be replaced and they'll be back to these numbers. That's a significant change in Oregon. When I was first elected in 2002, we had 25 Democrats in the House in the 2003 session, and so that's grown up to 36. So that's been a real sea change in Salem over the last well, I guess that is a long time now, for 24 years, because I'm old. Once again, we have a theme here. Yeah, so every 10 years, to Ali's point, they do legislative redistricting. This happens all across the country after the national census. So all the lines get drawn. So the state rep and state senator that you had 4 years ago could have changed with redistricting. Ali and I stayed in the same district as it did. The lines changed, but didn't include our homes. It's really important. I mean, legislators, not surprisingly, care most about their constituents. So if you're going down as part of a group of people lobbying legislators, I would always encourage you find a constituent who lives in their district and put that person out front, because they care the most, because those are the people who elect them and reelect them or don't. So they're always going to be more concerned about that. They also, in terms of what committees they serve on and what jurisdiction those committees have over the issues, that's important to be aware of when you're going into these meetings as well, because that is where they have built up expertise. And also, if you're trying to get, like we had our 988 funding bill, that had to go through the healthcare committee and then had to go through the revenue committee, and then ultimately had to go through the Ways and Means committee too. So meeting with folks on those three committees was important. So knowing your audience on that is important. It's also important to know, unlike California or New York or Texas, where they have full-time legislators, In Oregon, it's very much a citizen legislature. Each legislator is part-time. Their staffs are very important. I think that is, treating legislative staff well when you're interacting with legislators is really important because they are really integral to the process and will be either helpful or harmful to you depending on how you treat them. That's just human nature. I kind of talked about that. One of my former legislative colleagues used to say when people would complain about the legislature, and I think we've all done that, he would say the Oregon legislature looks and acts like Oregonians. So we know some people who are not particularly with it, right? There are some legislators like that too. We know some people who are extremists. There are some legislators like that too. So everything you know in your families and your friends and your colleagues, the Oregon legislature really does reflect Oregonians. I think he was right. If you could advance to the next slide. Maybe. Okay. So a little bit about some of the issues you might be interested in might relate to the budget, to spending. There's so many things, especially with the federal government, that are in jeopardy right now in terms of budgetary expenditures. But if you think about where your state tax dollars go, so the money we pay in income taxes, the money we pay in property taxes. Most states have three legs to that stool. They have a sales tax. Obviously, Oregon doesn't. But where those resources go, you can see, perhaps not surprisingly, the overwhelming share is education. So this includes both K-12 schools, which is about 40% of the pie, and then the remaining 15 or 14% is community colleges and universities and student financial aid. So the biggest chunk, we think about education as being a local thing, but it's really the state budget that the majority goes to education. And then significant chunks to health and human services. That's everything from the Oregon Health Plan to child welfare to just a whole variety of things within health and human services. Public safety in prisons. This is an area where if you look back 30 years, sadly, this piece of the pie has increased significantly. We're spending way too many dollars on this percentage of the pie. The size of the public safety was growing. I think it's largely stabilized in the last few years, but it's still a significant chunk. And then you can see everything else is in the 6%. So there's still a lot of dollars in that 6%, but when you look overall where everything is going, it's really some pretty significant large chunks of the pie. In terms of the process, if you know ahead of time, sometimes you may just be advocating for a particular funding ask that you're aware of, and that's fine, where it's already kind of all the way down here in the process. Sometimes you may be ahead of the curve, and maybe your organization has a good idea for a budget ask, and you want to go back to the agency way before the legislative session begins and try and get yourself into the agency request budget. That is your best chance to get in early in the process, so the agency is asking the governor for money for the thing you care about. And then you want to try and stay in the process as the governor's recommended budget come out. And then you want to try and stay in the process as the Ways and Means co-chair, that's the name of the budget committee, Ways and Means, as the budget committee's co-chair's recommended budget comes out. And then we get down to the May revenue forecasts, because Oregon, unlike national, has to have a balanced budget. There are no deficits passed at the state level. Everything has to be balanced. And so once the revenue forecast comes out, and in this case, it's going to come out next week, so we're right on the precipice of that, and they look at how many dollars are sitting in the reserve funds that the state has, then they'll do a legislatively adopted budget. And this is the one, unlike the federal government, the governor actually has to stick with this and spend the money as the legislature has directed. And so the more you can get in early in the process, the better. But sometimes there are definitely things that are just added late in the game, but it's just all the more difficult because you have momentum that's just been built by so many other folks along the way.
Stand up and stretch. So Dave introduced me. I'm Allie. I know some of you I don't know. I'm so glad this room is so full. I've been doing this work for a really long time, and for many, many years, I would say I hate politics. I don't want to deal with it. I don't want to look at the policy. But what I've learned over the years is I have to be political because we have to, that's how we get things changed and we get things working better for people. So I have been political now for many years. I've picked my issues. I've championed those issues where and when I could. Part of that has been my work with NAMI and being on the NAMI board. And sometimes I have been down to Salem and I've listened to people give testimony and they're all over the place. Yes, there are so many things we need to fix, but I pick two, maybe three each session, and that is what I'm going to focus on. Most recently, it was Dave mentioned the 988 stuff, fully funding that. As we were doing meeting with legislators last fall and into the winter, it was all about not just 988, but also so in Clackamas, we have a mobile crisis team that goes out for adults that are experiencing mental distress. And when I left Clackamas 2.5 years ago, we were working on creating a team for families with youth that were also having a tough time. And 2.5 years later, we still do not have that in place. And that's because of political barriers, honestly. It's not that the county doesn't want to do it, they want to do it. They have a plan for it. And so that was one of the issues that I picked in the last year is trying to get that finished, get a fully funded and working mobile crisis for everybody in the county, not just adults. There we go. So yeah, picking your issue is really important. Sometimes and we all know the climate we're in now, big federal issues, they're out there. However, those are not the issues you want to pick when going to the state legislature and talking to them about issues. You want to pick your state issues. Don't pick agency regulatory issues. Don't pick slam dunk stuff we already know is going to happen. That's putting our energy into something that we don't need to put the energy into. Don't pick the never going to happen issues. And we know that those come up and you're looking at somebody like, oh man, that's never going to pass. That's okay. It doesn't have to pass this year. So let's not put a bunch of energy into it. And like I was saying, don't pick too many. Pick two or three and know those issues. Do your research, which I think, have you already talked about that or is that on the next slide? I guess story is next slide. But have your ducks in a row when you talk to a legislator about issues. Put yourself out. We already know we're the experts in what we do as far as mental health and addiction recovery. Use that expertise when you're talking with legislators. Next slide. So legislators do want to know, what does this, I think I'm stepping outside the box. Uh, the legislators want to know what this looks like on the ground. What does this look like in your community? So I do share my story, my family story. When working on the issue around mobile crisis response for young people, I use a story of when my son was very young. And we didn't live in Clackamas County at the time, we lived in Portland. But he was, I don't know, 8 or 9. And he was having a really tough day, and he had this treehouse in our backyard, and he climbed up in the treehouse, and we could not get him down. He wanted to jump, all the things, and so we called the mobile crisis team that was available in Multnomah County at the time for youth. And that was very, very successful. They came out to the house. They had one guy climb up, I'm talking rickety ladder, and he climbed totally up into that tree, sat down on the floor of the treehouse with my son and just talked with him while my husband and I and his siblings are like panicking down on the ground. And they had somebody else there to actually work with the family on, okay, this is what this is going to look like. These are probably what next steps are going to be, and that sort of thing. And so I tell that story because that was successful, and we don't have that in Clackamas. I want that in Clackamas for families. They want to know what the impact of public policies and budgets. And we are, like I was saying, we are uniquely qualified, and we can be really effective with our story. So something else to think about is learn how to tell your story effectively. Turn your story, when you're speaking to a legislator, turn your story almost into bullet points, but with feeling and compassion. And, I'm a super emotional person. I cry over everything. And sometimes I don't even have to try, and I just have a little tear come down my face. And that is a genuine tear. That is not something I forced, but it works because that shows this is what this means to me as a family member, as a person with my own lived experiences, as a mother of children who also have their own challenges. And that personalization and the impact it has is really important. Okay. You get to do, um, well, I touched on do your research beforehand, so you can take it from here.
One thing I was going to note, should have been handed. There are a couple more of these outside on the table outside the door, but this is a sample memo that we use with our board members and volunteers when they're meeting with legislators. This just happens to be one that we use last November with Representative Christine Drazen, who's the House Republican leader. But it kind of gives you a flavor of the information we provide to people. Some background about the legislator. Again, know your audience. Some background about the issues they're working on, and then some bullet points that provide some of this fact information about the issues you're going to be advocating on. I agree completely with Ali. The most important thing you're going to share, the most important part of your meeting, is your personal story and how that intersects. It's always much more powerful and effective than all the factoids that you can come up with about the issue. Facts are important, but they're never as important as that personal story that really is going to capture their attention. But don't forget about the facts. Know how much the bill is going to cost if it has a fiscal impact. Know how much the taxes are going to raise if it has a revenue impact. Know how quickly it can be phased up. One of the things you'll see that we're asking for is funding for the more state funding for the mobile crisis response teams. Know what your county's mobile crisis response team looks like, where it's working, where the gaps are, how they would use more money. So I think there are a whole variety of things that go along with your story that Ali was talking about. It's kind of two sides of the same coin, having your story and having the facts to back up your requests. It's also sometimes helpful to have in your mind what are the opposition arguments and to preemptively raise those with legislators. Legislators really appreciate that. If you say, I know you may have heard that this is going to be a new tax on cell phone bills. For example, one of the things we would talk about with legislators is, do you know that every Oregonian is already paying $1.25 a month for 911 call services? This is asking for 40 cents for 988 call services. Far less, really the exact same kind of goal, but it preempts that argument. So the next time they hear an opposition argument, perhaps they can use your response to that opposition argument in response. Did you have a question? Okay, whatever your preference is. Okay, yes, ma'am. Actually, I'm sorry, there's a mic coming to you so people online and in the room can hear you.
Oh, hello. So one of the things that were mentioned was this was going back to like picking issues carefully. There was a mention of agency regulatory issues. Can you expand upon what that exactly means?
Do you want to talk about the ARB process, or you want me to? Okay, okay. So if you think about the legislative session, the first slide we talked about started off talking about the start of the legislative session in January. The governor's recommended budget comes out a couple months before that. The agency request budgets are due months and months before that. I've been out of the legislature long enough now. I don't even remember what the deadlines are, but I think it's like the spring. So if they're preparing for the 2025 session, the agencies have to request their budgets, I think, back in the spring of 2024. So getting in with agencies way early and making the case of here's something that you would like to see them request in their budget. They know their budget is going to get, I mean, they're kind of talking about their optimal ask budget that might get narrowed down or shifted when it goes into the governor's recommended budget, might get narrowed down or shifted or expanded when it comes through the legislature. But that's way in advance of the process. So like right now, it's not too early to start talking with agencies about their request budgets for the 2027-29 biennium, which seems ridiculous. But a year from now, they'll be finalizing those. So the earlier you get in, the better. So, as Ali just pointed to, this next to the last bullet, be willing to say, I don't know. You're not there to be an expert in everything. And you're far worse off if you just guess what the answer might be, because you could totally end up inadvertently ruining your credibility. If you guess incorrectly and they find out later, wait a second, somebody from XYZ mental health organization answered my question saying it's this and it's actually this. I realize at the national level, we're hearing all kinds of, you can skate by with fake information all the time. That is not, in the Oregon legislature, you can't get by with that. So be willing to say, I don't know. But also, importantly, the parenthetical part, follow up. Go find out after your meeting and email their staff or call their staff with that information. And I think this is also really important. As much as preparing yourself is important, making sure you bring other people with you or you send follow-up other messengers with you who can carry on your same message, maybe from a different perspective. I used to work in the port industry, like the maritime ports, and we would have some of our most effective meetings. We'd have somebody from a shipping company, somebody from a business who ships, somebody from a labor union who's dependent on the jobs in shipping, and that triumvirate of those three people, because they weren't used to seeing those people at the same table, they were all advocating for the same things. It brought new credibility.
And when we're talking about peers and peer support, what that might look like is having people who have the lived experience of addiction recovery, have the lived experience of addiction recovery and mental health recovery, have the experience of being a family member who has been affected by that whole experience, and what does that look like for a family, for children, for parents, all of that. That's what that team could look like, going in and talking about how these things affect each one of those groups of people who are actually, we're family units. I'm a mom. I've got 4 kids. 3 of them struggle in their own way. We have addiction, we have mental health, we have all kinds of stuff, and making sure that we present a group that represents all of those things is really important.
Such a good point. Thank you. If you could advance to the next slide, there you go. So thinking about different tools you can use in your advocacy. I think a lot of times, probably some of the easiest thing is to think about, gosh, once you know who your state rep and your state senator are, knowing where, and get on their email list. Every state rep and state legislator has an email list. Just email their office and ask to be put on that list. That way, when they have a constituent coffee or a town hall meeting, you'll be notified. And the majority of legislators in Oregon do regular town hall meetings or constituent coffees. Not all. The vast majority, well, yeah, I don't want to partisanize this, but the vast majority of legislators in the Portland metro area do regular town meetings and constituent coffees. So there is access, but go to those, because that's a great way in a casual environment. You're not going to get the same kind of time like when we get an hour meeting with a legislator just with folks from NAMI. That's invaluable. But for you to make a key point or ask a key question at a town meeting where they might be covering 20 topics, that's important, because that drip, drip, drip effect really makes a difference. Invite them to your special events. You might think they don't care about you, but you might be surprised. I am constantly amazed at how we'll have legislators come to our events and people say, gosh, how'd you get those legislators there? We invited them. It's no secret sauce. So ask them to come to your events. Now, definitely when they come to your events, recognize them. Don't invite them to your event, leave them off in the corner, introduce them around, and then recognize them when you have time with the mic. If you have time on your agenda, give them a chance to say something. Engage them in your events. That'll get them to see you and your stuff in action, but it also gives them exposure to their constituents.
How many people in here know Kevin Fitz? Okay. So then all of you know, every year he does like a barbecue at the, I don't know if it's spring or fall now, I can't remember. But he always has people there. He invites representatives. He invites uh, Oregon Health Authority people, the people working in behavioral health with Multnomah County. What, you know, whatever it is, they come because he invites them. They don't just show up, and that can kind of take some convincing sometimes, because often they kind of know what they're in for. But you know what? That's what they're there for, is to get the hard questions and try to answer those hard questions.
Oh, and that Kevin's a great example of a master of these of these two for sure. I kind of already talked about getting to know their personal and committee staff. It really doesn't matter how you communicate with them. If you're more comfortable with email, great. I mean, I have the mobile phone numbers for my legislators, so I will often text them if I really want to get their attention on something. Um, Visiting them in Salem, I think before the pandemic and everybody really got comfortable with Zoom, you really had to go to Salem. And it was a lot of time on I 5, a lot of wasted time, maybe waiting to testify or waiting for a meeting. Zoom has made it so much better, and the fact that you can now testify using Microsoft Teams before committee hearings. So this has really dramatically changed this bullet in just the last 5 years. So much easier access. Now, most of you probably are connected with 501c3s. So this bullet has nothing. So mentally take off your 501c3 hat for a moment, because like Nami Clackamas would never get involved in a legislative campaign. But Allie and I last year as individuals co-hosted a fundraiser for our state rep who was up for re-election. That was us as individuals. No Nami Clackamas branded on that. But that was very successful and really built credibility and connection with that legislator, because it was a really successful fundraiser for her, and she was in a very targeted race. She was, indeed. So getting involved in campaigns, this is probably most valuable in getting involved if you have an open seat in your district or getting involved in someone's first campaign. When I was first running for the legislature in 2002, literally the very first neighborhood I knocked on going door to door, I just happened to knock on the door of the then Nami Clackamas board president. So this is 23 years ago. And if you've ever knocked on doors campaigning, the rule of thumb is you're supposed to go about 3 minutes every door. Have a quick conversation, get to know them, tell them about you, and move on. Well, Stephen Loiza was not moving on in any way, and he had me there for like a half hour, but it was a fabulous education in mental health and a fabulous connection to Nami Clackamas, where I had none. And he ended up supporting my campaign. I started going to the NAMI Walk in 2002 and every year since. So getting involved early can really make a significant connection to an elected official. And as I said earlier, engaging different voices, as Ali really reiterated well, engaging different voices in singing from the same song sheet. So am I taking this one? Okay.
Okay, so be respectful and persistent. I had somebody, so I've sat on lots of committees, lots of councils over the years, and we were down in Salem at a big committee meeting. It was an all-day thing, taking a break for lunch. I'm sitting at the table, and a woman who was on the committee with me, we'd known each other for a long time, she looks up and she looks at me and she said, "You know what I really like about you, Allie, is that you can totally slap somebody in the face with your words and they don't even know you've done it." And that is the key. And it's to be honest, to be truthful, to be direct. And I always do it with a smile, and I do it with compassion, because we all got our stuff. But I also like to be assertive and let people know this is an important issue and I'm not letting go of this. And I really respect you for listening to me and hopefully taking this forward with me. You want to be very specific in what you're asking for. You can't come in with a big vision and no details. They don't have time to figure out what the details are and then spearhead that. You need to really provide that. Be persistent. Like I said, keep asking until you get an answer. And for me, that's that whole, getting to the point where I'm slapping them across the face and they don't even know it, but it's going to elicit an answer. Don't stop at no. Keep pushing, keep asking. Reword the question you're asking. Reword the action that you would like to be taken if that's what it takes to get to the yes. Thank them for meeting with you. Part of being respectful also is when thanking. And sometimes I forget to do this, but I always do try to use their title, Senator so-and-so, Representative so-and-so, thank you for meeting with us. We really appreciate your time. And then after they've taken action and you've seen that they're doing these things, thank them again, whether that's a phone call or an email or something, and publicly thank them. They are public servants. They are visible. They are supposed to be there as our elected representatives. So thanking them publicly and saying, hey, nice job, appreciate your time is really important. I think I was going to give you the amendment part because, again, that is your area.
Yeah, because sometimes they may say, actually, I can't support this because. Now, that's an opportunity for you to say, well, if we made an amendment to the bill that fixed that, could you then support it? So basically turn it back around on them. They thought they put a period after their response, but you can just kind of put a comma and see if there's a way to get them. Because the vast majority of bills, one of our priorities you'll see in a couple of slides this session is changing the state's civil commitment laws. That has so many amendments that have been incorporated to it over the last few months. But that's true with almost every bill. It is a very, very rare bill that is drafted perfectly the first time. Almost every bill needs amendment. So suggesting do they need more? Maybe they need more information, or maybe they want an amendment to a bill. Don't take that as a final answer. But I will confess, it is really easy for legislators to obfuscate on whether they will support something, especially something hard. And so, like when we had our 988 funding bill, because it involved revenue, a lot of legislators were hesitant about taxes, and they wouldn't really answer the question. So just keep asking it. To Allie's point, be persistent. Just keep coming back and asking them again. I should have started passing this around earlier, but if you would like to, we have a few more slides, but if you would like to be on our NAMI Clackamas email list that will tell you about advocacy opportunities, but also tell you about peer and family programming that's taking place. A lot of our support groups, a lot of our classes, and most of our advocacy is virtual now. So even if you're not in Clackamas County, we'd be happy to add you.
Is that a recluse?
To our list.
No, thanks.
Is there sound coming? Okay. Oh, I see. All right. So these are just a couple of slides that tell you that these pictures, well, at least the top two were before the pandemic.
Oh my God.
We were actually meeting face to face with legislators. I am curious, if you look at this slide on the left, any idea who the legislator is in this picture?
We're squaring up right
left. This guy? Okay. Other thoughts?
This guy? There's no way.
Okay. Any other thoughts?
Where the fuck is he? Oh. I got him.
This lady here? Okay. So interestingly, it's not this guy, although this is the one everybody's paying attention to. He's just a constituent. All four of these happen to be legislators. Well, he's a former legislator now, but this is actually the current Speaker of the House, Julie Fahey. Senator Floyd Przansky is in the legislature right now.
Okay,
longest serving member, and then Nancy Nathanson chairs the legislative committee. So yeah, this is an example where we actually had four legislators in the room. Often this is probably more typical where we just have one legislator. It happens he actually gave up his seat because there were several of us, so he gave up his seat and sat on his window ledge. But a lot of the ones we do now are on Zoom. So we have one legislator and 10 or 12 or 15 peers and family members who are there meeting with legislators, to Allie's point from earlier, telling the story of their experience and making the case for the ask. This picture from the bottom is actually with our new Clackamas County chair. We hosted a candidate forum, which we chose to do our candidate forum this year focused on our county commission seats because we had three of our 5 commission seats were up and 2 were really hotly contested. And in fact, the challengers in both those cases won, including the new county chair here. So that was a great way to make them come and talk with us for an hour about mental health issues, and it ended up being televised and put on cable access. So that was another way of getting the word out to them. Just so you know, if you haven't been in a committee hearing, this is kind of what it looks like up close and personal when you're testifying. It is a very intimate experience. You are really close up there. These are the legislators, and you can see, well, the one staff person is taking notes, but the other 3 are listening and really engaged. But it is a very intimate experience. You're up there testifying, and it's not intimidating like it is in D.C., where you have like multiple tiers of members of Congress kind of looking down and glaring down at you, or maybe chastising you. It's intimate, but it's a positive experience. I apologize for the slide being blurry on the top, but it kind of takes a step back and gives you a sense of what the room looks like. Even though it's really intimate at the front, you have a lot of people sitting behind you, including the television audience even further back. But the committee meeting rooms are still relatively small in Salem, much different from DC. This is actually a bill signing. I apologize for this being blurry too. One story I'll tell. This is now Congresswoman Janelle Bynum. This is actually the signing of the 988 funding bill in 2023. So Governor Kotek signing it. Representative Bynum, we actually met with her. She was one of our early meetings, and I've never experienced this before, but this was so fun because we had a whole bunch of peers and family members there making the case of their personal experience and why we needed this 988 funding bill. And yes, even though it was a tax, that we really needed her support. And near the end of the meeting, this is on Zoom, Representative Bynum said, "Can you just hold on a second?" And she turned 90 degrees, still on screen, and starts typing on her laptop. I thought, that is weird and kind of rude. And then she turns back and she says, "I just signed on as a co-sponsor of the bill," which is very cool in real time. And then she was there at the bill signing too. She became a big champion for it. And so this gives you a glimpse of what our 3 priority issues are for this legislative session we're in right now. You have probably read and heard a lot about the proposed changes to the state's civil commitment standards. It is, as many of you probably know, it is nearly impossible to have someone civilly committed in Oregon. The standard is just so high, so much higher than other states. Usually, in many cases, those people will be ultimately criminally committed because nothing is done on the front end, and so they end up in the criminal justice system, and then maybe they end up in the state hospital. This is trying to get ahead of that to get them the help they need and not eliminate the standards that are there or even dramatically lower them, but just slightly lower them so they're more accessible. There's a bunch of amendments that have been made to that bill. That's a major priority this legislative session. Not only to change the civil commitment standards, but also to have more civil commitment beds available across Oregon to be able to handle those folks. Our second goal is more funding for the mobile crisis response teams. We talked about fully funding 988. Oregon's funding for 988 call centers is in the best shape of any state because it has that revenue source. We need more funding for the other side of that coin, for local mobile crisis response teams. Because like in Clackamas County, as huge as it is, there is at most 1 mobile crisis response team at any given time. And you can't go from Mount Hood to Wilsonville to Lake Oswego to Malala. You can't do that with 1 team. So not only in our county, but in every county, we need more mobile crisis response teams. And last, more affordable housing that has mental health supports. I think legislators are talking a lot and making great progress on more affordable housing, but the asterisk, we think, is a higher percentage of those have to have the mental health supports built in. Can't just be the affordable housing, as important as that is. You bet.
If you know Clackamas County, you know that these three are all connected. And you are more likely to end up in jail than actually getting help in Clackamas County. And so the idea is to have those mobile crisis responsive, to have housing that works for people so we don't end up in the civil commitment place, or we don't end up with people that are being housed in the jail because they can't get in for mental health, treatment, support, whatever. I just wanted to make that point that these three really are all totally connected.
Yep. Well said. So we talked about kind of the early in the legislative session dates in terms of when they came in, how they get started in mid-January. As I mentioned, next week, May 14th, it's almost like kind of a starting gun that goes off toward the end of the legislative session. They will know exactly how much money they have to spend. Again, it's a forecast, and because of Oregon's stupid kicker law, too much relies on that in terms of the state budget, but that's based on what they budget off of. So once they know that on the 14th, next week, then that will be the march toward the end of the session, which has to end by June 29th. So things are really going to speed up in the next few weeks. A lot of bills have already died because if they didn't make it out of policy committees by a certain date, the bills were dead. If they didn't make it out of the first chamber where bills start, and bills can start in either the House or Senate, but if they didn't make it out of that chamber of origin, those bills are dead. But there's still a lot of bills alive, and so there's going to be a busy 6 weeks here to try and get not only the entire state budget, but also all the remaining policy bills done and off the table. So with that, we will open it up, and we'd be happy to take additional questions or comments you may have.
Hi, this was kind of harkening back to when you were discussing state budgets, but you said that it was disappointing to see more money going to like safety and the prison system when the prison system and safety is declining. So I'm just wondering if it's like an issue of like how the money is being spent, or why that would be an issue.
Well, and as I think I said, it was an expanding percentage for many years. It's kind of become a fixed percentage now, but you're right, it's not declining. And a lot of it is because a lot of those legacy costs of operating prisons, even if some of them have smaller populations, the cost of operating those prisons are still nearly identical to what they were when they had larger populations. And it's every time this governor or the prior governor proposes closing a prison, the community in which that prison is sited goes ballistic because that's jobs for them. A lot of them are sited in rural areas. And so you might think that would be non-controversial. Great. We need 2 fewer prisons. Let's close them, save all that money, unless you live in those communities and the jobs, because those are some of the best paying, best benefited jobs in those communities. So those are wildly controversial proposals, which is a lot of why we have these ongoing legacy costs for public safety.
And the funding of prisons, for me, it's so my son got clean going through the court system. It's not the case for everybody. It is for him. However, he can't get what he needs through the prison system right now, depending on where you are sent. That is what you get for treatment or support. He's in prison now. He's been shuffled all over the state, and it's okay that I talk about him. He's like, tell my story, Mom. So he started out in Snake River, which has nothing. Plus, the judge who sentenced him said he could not participate in any programs. Yes, it's part of his sentencing, which is insanity as far as I'm concerned, especially somebody who had 2 years clean going into prison. So this is why, for me, this is going to get into a whole bunch of stuff, but I don't want prisons privatized. I want to consider treatment and support for people who can really benefit from it. And right now, for my kid, let's talk about early release. He's 3 years clean. You know, he's doing well in prison, but he would do well outside of prison now. But he still has like 4 more years, I think, on his sentence. But let's talk about earning that too. If you are doing well, you've done your treatment, you're clean and sober, all the things, and that just is not an option for people right now. Often, I don't know. I could talk about this all day long because it really makes me mad. But we need to figure out a better way. And staying at that 17% of funding is not going to get us there. Increasing that budget is not going to get us there.
The other reason why that percentage has held so high is because voters in principally the 1990s passed a whole variety of mandatory minimum sentence laws. Legislature passed some, voters passed some, and that has meant the sentences have gotten far longer. So even if the crime rate is flat or declining, you still have people in for such a longer period of time, and you just have those legacy costs of the system that stick with you for a long time. Yes. Actually, do you have let's get you a mic there. Thank you.
Thank you. And I really mean this with utmost respect, but I'm curious, like, is your NAMI about 50-50 parents and peers, or like what's that split like? Or is it mostly a parent organization, or kind of a pretty well mixed?
I'd say it's probably 50-50. I mean, we actually have a few more peer support groups than we do family support groups.
Uh-huh.
We probably have, well, actually, right now, our peer-to-peer class actually has more signups than our family-to-family class. Yeah, I mean, it varies. Definitely founded 45 years ago by parents.
Right. Yeah.
But it has definitely evolved. And like right now, we have 4 family support groups, and we have, I think, 7 peer support groups. And our 3 peer support specialists on staff. I think the mix, it varies a little bit week to week, but in general, it's about 60% peers, 40% family members.
Thank you so much for that,
Yeah.
because I live in Clackamas County and I've not really like tracked what you're doing or been involved at all, but I'm also really curious about I'm not an expert on this, but I'm very curious about like making civil commitment easier. I know we don't want people in jail. I'm 100%
Right.
with you on that, but I also get worried if we make it too easy. I mean, why are you also advocating really hard for the upstream things, so that when people are first having a hard time, they actually can get access to the support they need before they are actually having to be forcibly in a hospital or something? I mean, it just seems like, to me, that seems like the real problem, but there's probably many.
Well, and you know me, Sharon, I agree with you. It is a slippery slope. It is a slippery slope. And I think part of, for me, and I'm watching very carefully because it worries me too, but part of it for me is the stories I've heard and the research I have read from people who have we can use suicide as the example, have had an attempt and have stated that they realized at the last minute, no, this is not what I want. And if I had been thinking clearly, I would not have made that choice. Or I've heard people talk about committing crimes, and if I had been thinking clearly, I would have never done that. So those are the things I think about also. And my son has stated, he's been in mental health services since he was 4, and developed the heroin addiction later on. And part of that comes from his mental health and what he has struggled with. It comes from trauma he's experienced. And he's had a number of suicide attempts. And I listened to his story too. And like, Mom, why didn't you do anything? I've heard that a number of times from him. And there have been times I've tried and I couldn't. And he was pushing back and hated me for it. But later on, he's like, Mom, why didn't you do something? So these are the different stories. So I struggle with it, Sharon. I really do. I hear you.
We have a question from the chat here about Measure 11 and money for poor communities. And the question is, are privatization of new prisons coming via Kevin Mannix?
Well, if Kevin Mannix were in charge, I'm sure he would love to privatize prisons, but he is now in the minority as opposed to all the years when he passed most of those Measure 11 and those other bills. So I'd be stunned if there's any serious effort toward privatization of prisons in Oregon, but it's definitely a thing in a lot of other states, and we see discussion about it at the federal level. But I think that's as concerned about as we should be about many things. That's one I don't think we have to worry about in Oregon.
Thank you.
Other question, and is that sign up sheet still making its way somewhere? Great, perfect. Yes.
Hi, I was wondering if we could swing back to the question of like agency regulatory issues versus legislative ones. I think that the budget piece was a helpful insight. I live and breathe like the program side, and so the spaces that I'm probably the most comfortable are like the administrative rules. What could you give some examples of like what you might see as being a legislative level useful thing as far as like peer workforce is concerned, and how that might look different than like at the administrative rules level?
So, and it really does vary issue upon issue. Probably my two immediate answers would be sometimes the legislature might appropriate dollars and the governor signs that to an agency, but the agency has a lot of flexibility as to how they implement that. So, like the legislature is not going to say you must hire 139 peer support specialists. They're not going to give that level of detail. They're going to give them a bucket of dollars, give the agency a bucket of dollars that might go to peer support. So you can work with an agency on the back end in terms of implementation of dollars. But sometimes there are also issues that really never go through the legislature where the agency just has rule writing authority. Now, I was actually just in my neighborhood association dealing with one negative example of this, but the legislature passed this was not a healthcare thing, but it was a sustainable energy bill that passed, and they gave way too much authority to the agency, and the agency wrote these ridiculous rules, basically to benefit. They're going to benefit developers at the expense of neighborhood livability. But that was a case where the agency did. Once I read the bill, I actually had to acknowledge the agency did have the authority. So then we're going to have to go back to the legislature to rewrite the original bill, because in this case, the agency was not persuadable. They think they're doing the right thing. And so sometimes the agency can be your big allies, and I think this is probably especially true in OHA. It's not true in LCDC, the Land Conservation Development Commission, but I don't think. But a lot of times, because they have so much more expertise than the average legislator, they may be your biggest ally. So I think having those open lines of communication with them, whether it's leading toward a future budget request, whether it's looking back toward a past budget appropriation and how they spend it, or whether it's asking for them to spin out some rules that are more favorable to what you want. Just having that dialogue. And in my experience, most agency folks will be pretty straight shooters and tell you whether they have the authority or not, and they may even strategize with you. Sometimes they want to do that on the QT, but strategize with you about how to approach legislators about those issues. Yes. Thank you.
Hey, just a quick question. So, I want to go back to when you were talking about Ali, when you were saying, make sure that your ideas are like bullet points and like emotional, straight to the point. What would you guys recommend when submitting your proposals? Like email, do you address it to like to whom this may concern? Like, how do you structure your proposals? Or
I've always addressed it directly to my senator or my House rep from where I live, and I will address it, Representative so-and-so. I use their title. And I don't try, I know it's going to go to a staffer first, and that's fine because their staffers have influence with whoever they're working for. So, and bringing that emotion into it, but keeping it short. So you don't want to write a novel. They're not going to read a whole novel. Who has time for that? But keeping it short and sweet, to the point, and emotional will get that in front of your rep, from the staffer to the rep. It's been my experience anyway. Does that answer your question? Or
yeah,
no?
I'm such a visual person. I think I want to look at some examples.
And you can, if you Google it, you'll find
Yeah.
a ton of examples online of how to write a letter to your representative.
Thank you.
Even though this memo was for a face-to-face meeting, did you get one of these? You can have this one. Even though if you look at the bottom of that first page, those bullets, even though that was for a face-to-face meeting, that those bullets I think largely give you the structure for an email as well, because it's important to identify yourself if you are their constituents, if you are identifying that very clearly, and then sharing your story and ending with a very specific ask. Like what the subject line is might be in an email. If you know the bill number, I would definitely put that in the subject line. If you don't know the bill number, maybe you can just say it's related to civil commitment or mobile crisis response teams. I wouldn't leave the subject line generic. I'd try it because they're looking through so many of those emails. The more they can get that in the right file, the better, whether it's with a bill number or a topic. Yes, Mike's coming your way.
I had a few questions, or two exactly, about the civil commitment legislative proposal. The first one was if you have off the top of your head any like policy research that went into I guess determining, for instance, some of like the verbiage, danger to self, danger to others. Like, did you look to other states and like their current policy on civil commitment?
Yeah.
When doing so, and I'll just let you answer that one first.
Absolutely, and this is one of the. I mean, in a lot of times, Oregon has the more thoughtful, progressive law already than other states. This is one where I just think we're behind. So there were lots of other examples of other states that had defined it differently. Oregon, if you look at the Oregon Constitution, we have one of the strongest free speech, free exercise language in our Constitution. It's actually stronger than the federal Constitution, which sometimes messes us up, like on campaign finance reform. The courts for many years interpreted that and said, well, Oregon has free speech. We can't say anyone is limited in how much they can spend on a campaign, which is obviously not the intent of that. But it's the straight reading of the language. And so this is one where some of the constitutional language and some of the statutory language was just very broad. So it really is trying to tweak a lot of the language is getting at the whole issue of immediate harm. I don't know if that's in yeah, like if you look at the danger to self, danger to others, so much of that is written and has been interpreted by courts in Oregon in a way that is only looking at, is there immediate harm? So they might be worried about what the person's going to do in a week or a month, but they can't civilly commit them unless they meet that immediate harm standard. And that's what we're trying to tweak slightly, based, to your point, on what's happened in other states.
Yeah, I'm from Massachusetts, and that verbiage struck me because that's, pretty much, that's literally what it says in their statute. So
Okay.
that was a lob. That was a freebie.
Okay.
And then
So the second one's not a freebie?
No.
This is the hard one. Okay.
The second one is about
the second one then.
accountability and the chance in the case that you're utterly successful in terms of involving basically the state hospitals. The policy assumes that they are able to undertake more people, and in that assumption is that the people that are being housed there currently are receiving quality of care. So without getting way too into the weeds with that, in drafting the policy and in the work group, was there any, I guess, like exploration of like ways that oversight could be increased, to meet the new level of responsibility or the new level of just capacity you'd be inviting by changing the policy?
Yeah, absolutely. And it doesn't show up in that bill because that bill is just a policy bill, so it's just changing. But there is a budget request in the Ways and Means Committee to dramatically expand the number of beds. Frankly, not just in the state hospital, because the state hospital, the two locations for the state hospital are so far from so many families in the Portland area and in other parts of the state. We really need to go back to what the original vision was. If you look back to when Fairview and Damish were closed decades and decades and decades ago, the vision was stop the big institutionalization and have much more based community of care all over the state. That's the vision that I think is trying to be recaptured right now. So definitely more beds. It's not, we would definitely not argue it's just a matter of better administering beds at the state hospital. We need more beds if we are going to make it slightly easier to access civil commitment statutes. There have to be more beds, and hopefully they'll be based all over the state. And we've asked the legislature to appropriate money this session to make that happen.
Okay, I lied. I have a 2B. This is now a technical question because I'm also in a public health master's and I had to write one of these policy briefs this semester. We could only be 8 pages and it was very difficult. But one of the things that actually came up is not related to any of this. It was actually very uninteresting, had to do with water. But it's a funny when you get into a policy and you're already thinking of ways to reinforce it, but then would require further legislation. Like you can only make in some ways one ask per bill, I guess as a group one ask. So like you were saying, like the more beds was a part of that. If you could propose like a follow-up piece of legislation to, like, for instance, advocate for like community-based, sort of like so like the state hospital equivalency, I guess, for holding, like what would that look like? Yeah.
I mean, I do think that's going to be a future legislative session, and I wouldn't be surprised if there's future bills in future legislative sessions specifically around additional tweaks to the state civil commitment law. I think this is really focused to be a modest step that's not going to fully solve the problem, but hopefully will be a step in the right direction. If you want to pass the mic, yeah.
Thanks. My question is about the affordable housing with mental health. How are you thinking of legislating that?
That's largely through there's not a policy bill around that. It really is, as they're putting dollars out in various budgets as part of the Ways and Means process, constantly reminding legislators affordable housing is great. We're all for that. And some of those have to be beds with mental health supports. Otherwise, we're just going to be solved. Now, obviously, the challenge is we have such a huge affordable housing crisis that there's no way they're going to be able to solve it with what they do this session or next session or the following session. So it really is trying to chip away both at the affordable housing crisis and recognizing that there are so many folks who are suffering from some mental health condition who, to be successful in affordable housing, have to have those supports on site. So it's definitely not a one size fits all. There is a questioner in the very back. I think it's on. It's just really quiet.
2025. Wow. I have 3 questions. They're little ones though. They're all just like rapid fire things that you like or might recommend for further reading. So I'm looking for either of you to tell me about an organization or some training that I can look into on legislating well.
That's a good question. We actually did. We've tried. NAMI Clackamas has tried to do more around advocacy because so many people are scared of advocacy. We actually just did a webinar that I think is up on our YouTube channel now. We did a month or 2 ago. But I think, I mean, if you sign up for our mailing list, you will find out when we're doing stuff. But I don't know of other organizations specifically focused on that.
Well, if you sign up to participate in like legislative days with an organization, whether that's NAMI or 4D or somebody else that I know who does those, they will give you information on how to do that. You become part of their cohort that's going to go down to Salem all at once and do that. And they will, my experience has been, you'll get trained in, okay, this is what's going to happen today. Do your bullet points, all of that kind of thing so that you're ready when you walk in there. It's not like a formal training, like we sit down and do a training, but they give you some tips and tricks for sure.
Okay, so look for legislative days in the email header. I can do that. Are there any organizations that this isn't a recommendation or endorsement, but maybe you just you really like the way they do organization stuff in the area?
When you say organization stuff,
Yeah, as in like
advocacy specifically, or
as in like you might really enjoy an organization's mission, and you might really enjoy the way that an organization goes about their mission. Is there an organization whose mission you really like the way they go about their mission? You can say NAMI Clackamas.
This is what I will tell you. About a month after I left Clackamas County, I get an email from Dave, and he's like, "Now that you're available, would you like to sit on the NAMI board?" And I said, "Dave, you know I don't like NAMI. I don't like NAMI. I'm not a fan." And and what it really came down to is that's what he was looking for, somebody who was not a fan. So it's I like organizations that will participate in discourse and conversation, and that the board is made up of people with lots of different views and experiences and life events that they've had. That to me is really important. Mission driven, if you like the mission of an organization, find out, are they really following their mission in the work that they're doing? And that can be pointed questions to staff, to their board, to the, whatever, send an email and ask their executive director, that sort of thing.
There are so many nonprofits nationally and in Oregon who are walking away from things like DEI commitments, other things. Some for illegitimate reasons, some because they're really fear they're going to lose a ton of federal money or something. I've got to say, it was so great. Our board that Allie chairs just last Friday spent a huge chunk of time really doubling down on their commitment to DEI, adopting a new DEI policy statement, having a whole conversation around some DEI tests, some, yeah. 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 We've increased our queer programming. So, I mean, looking for things that are real priorities for you and what the trend lines are for that organization. Are they moving forward on something? They're never going to be perfect on anything. We're certainly not. But are they moving in the right direction on something? Are they retrenching? Because I've never seen organizations retrench from issues like they are right now just because of some of the wildness that's happening at the federal level. Those were not softball questions. I don't know. That was a lie you said.
I just got to get my foot in the door somehow. So my last one, and then I'll yield my time, is it seems like at the state level, there's a pretty big bottleneck between like opinions and resources in urban communities versus rural communities, like how you were talking about a lot of job dependency on prisons in some of these rural communities. Do you know of anyone or anything that's kind of bridging the gap between a lot of us here who care a lot about mental health services and who want to see better systems and support across the state to people who are just having a different conversation because they're trying to figure out how to eat, if that makes sense.
Yeah, I mean there is and has been a rural divide in Oregon for a long time period. It's kind of ironic because in a lot of rural communities, they think that all the money from the state is being spent in the urban communities, when actually, if you look at where dollars are going from and coming from, rural areas are disproportionately being subsidized by taxpayers in the urban areas, which will just blow the mind of a lot of rural Oregonians. So I don't think there's one. I mean, I think there are some good elected officials. I see like Attorney General Dan Rayfield is really out there in all parts of the state. I think the governor's done a good job trying to build connections with a lot of parts of the state and better get to know them. I think one of the benefits, I mean, frankly, the old legislative Democratic caucus that I used to sit in when it was only 25 members was all urban and suburban members. Like I was the furthest district out. Now, if you look at the 36 members, they've got multiple members from east of the mountains. They've got members from rural districts in the valley. And so the governing party is in a much better shape right now, I think, in terms of understanding and representing those concerns. Not sure that fully answers your question. You bet. I think we are. Do you have any more questions in the chat online? Okay. Any last questions? Allie and I will also be hanging around for a few more minutes if you want to come up and ask questions. Last question right here. You got it. Jeez, he's bringing you a mic though. No, right here.
So, coming back to housing, that intersection of housing and healthcare, one of the things that's a total splinter in my brain is that hospitalization, residential treatment, incarceration, none of those things count toward houselessness, which substantially diminishes your options for supportive housing, right? Especially when it comes to like that intersection of mental health and housing. Legislation or administrative rules? Where should I put my eggs? Because that's a thing.
Yeah, I mean, because ultimately there have to be dollars that are going to solve that problem. Some
Yeah,
piece of
yeah.
that has to be legislative.
Permanent supportive housing, none of
Yeah.
which like where I work does a lot of residential treatment, does a lot of permanent supportive housing. There is no way to connect those continuums based on the requirements for how each set of dollars gets used.
And you're in the metro area?
Yeah.
I mean, my actually first instinct was because there's so many metro supportive housing dollars coming through the pipeline right now, dominantly spent by the 3 counties in the metro area. I actually think that's actually probably where I would start on this issue because those counties all operate those jails that are having where I mean we do mental health classes every week in the county jail in Clackamas County, and we see this exact problem. People are released, boom, here's the transition center. There's no housing available at the transition center. Guess what? They're back in the houselessness in a lot of the cases, and they end up in too many cases back in jail. And so I think the counties may be in the best place. I mean, I know in Clackamas County, because our new chair is the former sheriff and has identified mental health as the #1 issue on his agenda, I think for our county, that's a receptive audience. I assume that's probably true in the other 2 metro counties as well. And they have all those dollars coming from the supportive housing services measure at Metro. Thank you so much for your participation. Thanks for the opportunity to be here. The QR code is coming on the screen momentarily if you need it for CEUs. Or it's going to be in the front where? Oh, okay. So the QR code's right on the front table here if you need it.